GPs in New South Wales will soon be able to diagnose and treat people with attention deficit hyperactivity disorder. The state government will fund the training of 1,000 doctors to treat the condition in both children and adults. Previously, patients would need a referral to a specialist to receive a diagnosis and treatment.
I want to see all our healthcare professionals working at their full scope of practice, and when people are waiting up to 2 years to get a diagnosis and then ongoing treatment, it's my responsibility and the Mental Health Minister's responsibility to make sure that we're looking at ways to reform that system. And we believe our highly trained GPs with additional training can carry out this task and provide that access to the care that people suffering from ADHD need. We know that somewhere between 6 to 10% of the population, we estimate, has ADHD, and what we do know from our records is that some people wait up to 2 years to get a diagnosis. Particularly important for young people to be diagnosed as quickly as possible, because it certainly can impact on their education and developmental skills and needs that they require as they go forward. So our priority with this reform will be around making sure that we can get to see those young people as quickly as possible in the first round. I know for a fact, and most people do know, that our healthcare professionals in New South Wales are highly trained and highly skilled, some of the best in the world. So I know with additional training from our GPs who will undertake that type of training to be involved in this program, I'm very confident that we will get the balance right. Whilst we make sure that over-diagnosis we don't want to see, what we've got a challenge of now is actually people getting a diagnosis and getting access to that prescription. That can help, particularly with our young people, their development going forward.
Well, let's bring in Dr. Max Mollenkopf, who is the Deputy New South Wales ACT Chair of the Royal Australian College of General Practitioners. Doctor, good morning to you. Is this something that general practitioners support?
Yeah, good morning. I think this is a really fantastic change. We have found for years now where we have so many patients who are struggling to access diagnosis and struggling to access treatment. They've had these tremendously long wait times to access specialist care. And we're really excited to see some changes where we can help to really support these patients moving forward and help them to get more local care from their GP in the area.
What sort of things will the training involve? Because I guess a paediatrician will tell you it is very niche and specialised in determining in the first place whether someone is ADHD.
So at the moment, we haven't got the details on what exactly the training will involve, but we can speculate based on some of the other states that are currently sort of working in this area. I think we need to recognise that GPs already manage a huge number of patients with ADHD. We already see these patients in our clinics every day. We're already recognising the signs of ADHD, already helping patients to go through that initial process of finding their diagnosis, finding the right specialist, finding their care. I think it's just a matter of upskilling some of us to continue to do some of those more medical management options. And I think it's just a really great recognition of the skills we already have and helping us to do more in the space.
And helping with the costs as well, because the bottom line is if you can even find a psychiatrist or a paediatrician, then you've got to try and get an appointment with them that's not 6 months away, and then the costs involved.
Absolutely. I think in any space where you have a very narrow spectrum of specialists that can provide the care, unfortunately, prices will tend to rise and access will continue to be restricted. I think we will naturally see the costs fall to all healthcare consumers as GPs are opened up in this space to do more within the scope of what they can provide. And more importantly, I think it's just allowing that really early access. So when we look at children, we know that an early diagnosis and early interventions help them so much throughout those early years of school when they really need the most support. So I think this is a really great opportunity.
Is part of the problem being driven by increases in diagnosis of ADHD, which we know there is, that could be social factors, could be much more social awareness. But do you think that part of the problem is that more diagnosis and the profession hasn't caught up with it, if you like, in terms of the number of paediatricians, psychiatrists and general practitioners?
I think the rates of ADHD have remained constant in the community. We are just now more aware than ever, and we are understanding more and helping consumers understand more that ADHD can present in many different ways. If you are female, for example, you might present with different symptoms to that classic stereotype of the young male ADHD patient. So, I mean, I would argue that at the moment we're simply catching up with everything that's out there, and we're just finding more and more people that have always been there in plain sight.
1,000 is what is planned, 1,000 GPs to be trained up to start with. I'm sure every general practice in the whole state will have several ADHD patients. So is 1,000 enough?
I think we can't let perfection get in the way of progress here. I think we need to start somewhere, and hopefully we can show the value we demonstrate in the space, and the government can continue to expand with us as we do more.
How quickly are you being told, are you reckoning it can be rolled out?
The initial sort of information is that we're hoping that early in 2026 we can start to be actively treating some patients. But again, we're sort of waiting on some of the final details from government around what the training involves, and how much of an undertaking that is for our clinicians. But yeah, we're hoping to get on the road as soon as possible.
Do some GPs have concerns about the actual prescription side of it? Because as you're well aware, some of the medications that are used in these cases are controlled drugs.
So I think different GPs will often have different skills in different areas. The program at the moment is recognising that some GPs are much more proactive and much more interested in helping their patients in this space. And that's why there's further training being offered. There will always be, like any category of sort of general medicine and general practice, there will always be some GPs who are less comfortable and less familiar and might find themselves referring to their peers within the practice to support these changes and to do more with their patients. So look, I think it's the further training is an important part of this announcement, and important part of this process. It's helping GPs that really want to do more with their patients to access it, and hopefully helping patients to just get more care earlier in their journey.
Dr. Max Mollenkopf, thank you very much for your time. That system coming to New South Wales. The WA and Queensland already has it. Thank you so much.
Thank you.